Hi students, today in this session we are going to learn about an important component of our body, water, and how to assess the water level in our body. You will be able to gain knowledge about tests used for assessing the hydration status. Secondly, understand about biomarkers, complex marker and simple markers. Learn about simple tests carried out to determine dehydrated conditions. Before going into the assessment, we will look into the different definitions dealing with this chapter. First one is the euhydration. This is nothing but the state or situation of being in water balance. Hyperhydration is a state of being in positive water balance or excess of water, and hypohydration the state of being in negative water balance or water deficit. Dehydration is the process of losing water from the body, and rehydration the process of gaining body water. Euhydration, however, is not a steady state, but it is rather a dynamic state in that we continually lose water from the body, and there may be a time delay before replacing it, or we may take in a slight excess and then lose this. Next is the hydration. Hydration involves a point at which the body presently resides among states of euhydration, hyperhydration and dehydration. Next we will look into the definition of hyperhydration. This is nothing but, or this exists when ingested fluid temporarily increases total body water above the average basal level prior to its removal by the kidneys. Next is the osmolality. The concentration of solution is expressed in milliosmoles of solute particles per kilogram of water. Total body water. The fluid that occupies intracellular and extracellular spaces is the body mass. Extracellular volume. All fluid outside of cells includes the interstitial fluid and plasma water of body mass. Intracellular volume. The fluid within tissue cells of body mass is the intracellular volume. Daily water needs are highly individual and depend upon body composition, size, dietary solute intake, physical activity and fitness level, and other factors such as climate, environment and disease. Individuals can track daily intake adjusting to the climate, diet and physical activity, and track the urine output, more specific urine concentration reflecting the renal regulation required to maintain water balance in response to varying levels of water intake and loss. Thus, urine concentration has greater utility for the individual assessment of daily water intake, as differences in daily total water intake, sweat loss, dietary solute load and climate are all reflected in the volume and concentration of 24-hour urine. Regulation of hydration status. Only a small amount of water, that is 250 ml per day, is produced by metabolism in humans because water balance is highly dependent on dietary intakes and nutrient availability. Body water balance is usually compensated within 24 hours. Body water intake and renal water losses are controlled to achieve water balance, while sweating and expiration of regulatory vapors are not regulated. Minute changes in plasma osmolality are the main factors that stimulate the two main homeostatic mechanisms, the release of antidiuretic hormone arginine, vasopressin and thirst. Assessment techniques aim to measure one or more fluid compartments either directly or indirectly. Some of the methods attempt to compare the sizes of the individual compartments. Others rely on biomarkers estimating the concentration of the solutes found in body fluids, or attempt to assess the hydration status using the physiological signs and symptoms. This figure shows you the body fluid compartments, and that comprise about 42 liters of total body water in a human weighing 70 kg. See, when you're looking into this figure, this is divided into, or the body is divided into two compartments, the extracellular and the intracellular fluid. Intracellular fluid contains 28 liters of water, and the extracellular compartment, which has 14 liters of water, is divided into the extracellular fluid, which has 14 liters of water, comprises of the plasma, which has 3 liters, and the interstitial fluid, which has 11 liters. The water gained is through water intake in fluids and food, and the loss of water is through urine, sweat, feces, and by respiratory vapor. It is difficult to describe hydration status and hydration extremes because fluid intakes and excretion patterns of free living individuals are poorly documented, and regulation of human water balance is complex and dynamic. Hydration status has been attempted to be assessed in a variety of situations for a number of years. Earlier in 1975, Grant and Kubo divided the tests open to use in a clinical setting into 3 categories. The first one is the laboratory test, the second one objective non-invasive measurements, and third one subjective observations. The laboratory tests were measures of serum osmolality and sodium concentration, blood urea, nitrogen, hematocrit and urine osmolality. The objective non-invasive measurements included body mass, intake and output measurements, stool number and consistency, and vital signs, for example, the temperature, heart rate, and respiratory rate. The subjective observations were skin turgor, thirst, and mucous membrane moisture. Subjective measurements are least reliable in terms of consistency of measurement between the measurers. They were the simplest, fastest, and also the most economical. The laboratory tests were deemed to be the most accurate means to assess a patient's hydration status, and there has been a large amount of research into some of these measurements, observations, and tests. The following table gives the characteristics of biomarkers and the fluid in which it is being done. For example, hydration assessment technique is all the body fluids are involved, and the stable isotope dilution, all ECF and ICF is involved. Neutron activation analysis also, everything is involved, and the body mass change, plasma osmolality, they are done in ECF, and plasma volume change is done in blood. And in excreted urine, the urine osmolality, urine specific gravity, urine conductivity, urine color, and 24-hour urine volume are all being carried out. And in saliva, salivary flow rate osmolality and total protein has been carried out. Now we will look into the complex marker test. Fluid intake surveys provide qualitative data, whereas water balance studies and biochemical assessments offer quantitative support for the adequacy of reported intakes. The combination of total body water and plasma osmolality provides the gold standard for hydration assessment. Now, the total body water measurement. The process of measuring water balance by collecting input and output data has been modernized by estimating the total body water, which entails measuring the dilution of trace amounts of an isotope. Usually deuterium oxide is used. A known volume and concentration of isotope is taken into the body, and a new concentration of the isotope is later determined in a sample of body fluid. That is, the body fluid can be either blood, saliva or anything else, after the tracer has become distributed equally throughout the body fluids. The unknown volume TBW is then calculated, knowing that a low concentration of the isotope in the sample means that the body fluid volume must be relatively large and vice versa. Next is the plasma osmolality. Excessive sweat losses, if not replaced, reduce body water volume. Plasma volume and extracellular water decrease because they provide the fluid for sweat, and plasma osmolality increases because sweat is hypotonic relative to plasma. In other words, sweat removes relatively more water from body fluids than solutes like sodium and chloride, and these osmotically active solutes build up in the blood plasma. The increase in plasma osmotic pressure is proportional to the decrease in total body water. These gold standards of hydration assessment are good for sports science, medicine, or for establishing reference criteria, but because they require considerable methodological control and expensive, and they require analytical expertise, they are not of practical use for monitoring day-to-day hydration status during training or competition. Next, we will look into the simple markers. Hydration status afford athletes or coach the ability to monitor daily fluid balance. Relatively inexpensive and easy to use commercial instruments are available for assessing urine specific gravity and conductivity, which is an osmolality equivalent. A urine color chart is also available for this. Next, we will look into the urine concentration. Urine analysis is a frequently used clinical measure to distinguish between normal and pathological conditions. Urinary markers for dehydration include a reduced urine volume and a high urine specific gravity, a high urine osmolality, and a dark urine color. Urine is a solution of water and various other substances, and the concentration of these substances increases with a reduction in urine volume, which is associated with dehydration. Urine output is roughly 1 to 2 liters per day, but it can be increased tenfold when consuming large volumes of fluid. This large capacity to vary urine output represents the primary avenue to regulate net body water balance across a broad range of fluid intake volumes and fluid losses from other avenues. Next is the body mass. It is often used to assess the rapid changes of athlete hydration in both laboratory and field environments. Acute changes in hydration are calculated as the difference between pre and post exercise body mass. The other markers that have been used and investigated are, first one is the blood markers. Blood-borne markers of hydration other than osmolality include plasma volume, plasma sodium, and concentrations of fluid regulatory hormones in plasma. Under controlled conditions, that is during exercise, temperature and posture, most plasma markers reliably measures changes in hydration. Although all plasma markers of hydration assessment involve blood sampling with varying degrees of subsequent analytical difficulty, plasma osmolality is the simplest, most accurate and reliable plasma marker for tracking hydration changes. Next one which we are using is the Bio-Impedance method. Bioelectrical impedance analysis, or the BIA, is a non-invasive technique that can be used to estimate the total body water. It uses low amperage current, that is either single or multiple frequency, passed between skin electrodes with the assumption that current resistance or the impedance varies inversely with tissue water and electrolyte content. Although BIA is sensitive for detecting hypertonic hypovolemia, it significantly underestimates the level of absolute fluid losses and is independently altered by changes in body fluid volume and tonicity. Shifts of body fluids between intracellular and extracellular compartments during exercise, sweating, rehydration and other variables common to athletic situations also confound its accuracy and make BIA unacceptable to monitor changes in hydration status. Next is saliva and the symptoms. Saliva is not widely studied as like other body fluids for potential monitoring of hydration, but salivary osmolality appears to track changes in hydration brought on by sweating. However, individual responses of saliva osmolality to changes in hydration are somewhat more variable than those for urine and much more variable than those for plasma. Importantly, the influence of common food and beverage intake and oral hygienic practices on saliva indices has not been investigated. Although genuine thirst develops only after dehydration is present and it is alleviated before euhydration is achieved, thirst is a useful symptom that draws attention to the need for more structured drinking before, during or after exercise. An even simpler approach for self-monitoring of day-to-day hydration changes is proposed for athletes. This approach is represented using a Venn diagram decision tool which is given here. It combines three of the simplest markers of hydration, including weight, urine and thirst. No marker by itself provides enough evidence of dehydration, but the combination of any two simple self-assessment markers means dehydration is likely. This table gives you in a nutshell the techniques and its advantages and disadvantages. Now we will look into the complex markers. The first one is the total body water method. This advantage of this is it's very accurate and reliable. The disadvantage of using this method is it is analytically very complex and very expensive and requires a baseline. The next one is the plasma osmolality, which is also very accurate and reliable. Also we can tell it is a gold standard, and similar to the previous one, it is analytically complex, expensive and invasive. The next are the simple markers. The first one in simple marker is the urine concentration. It is easy, rapid screening tool and the disadvantage is easily confounded and timing is critical, frequency and color is subjective. The body mass is advantage of using this method is it is very easy, rapid screening tool, and again the disadvantage is it is confounded over time by changes in body composition. The other markers used is in blood is the plasma volume, plasma sodium, fluid balance. These have nothing very much special advantages over osmolality except the hyponatremia detection which is used for plasma sodium, and the disadvantage is analytically it is very complex, expensive, invasive and with multiple confounders. The next one is the bio-impedance measurement. It is easy and rapid, but it requires a baseline and has multiple confounders. The next is the saliva, where again the advantage is it is easy and rapid, but the disadvantage is it is highly variable, it is immature marker with multiple confounders. The physical signs test, it is easy and rapid, but the disadvantage is it is very much generalized and subjective. Thirst which is used, the advantage of this is it has a positive symptomology, but the disadvantage is it develops too late and is quenched too soon also. So now you would have understand the advantages and disadvantages of different biomarkers. Next one is the urine color, which is a very simple measure used, and this differs between low volume and high volume water consumption, and it is responsive to changes in daily total fluid intake. Urine color also has been used with reasonable accuracy when laboratory analysis is not available or when there is a need for quick estimation of hydration is necessary. See, this is the chart given for urine color estimation. What we will have to do is, it is done in 3 steps. The urine color has to be matched with this color in the chart. The first step is match the color of the urine to a color in the chart, and the next step is determine your level of hydration to dehydration. The lower the number, the better the result. Third step is, if in the color urine color matches the following points, you can assess. First one is, if the urine color matches numbers 1, 2 or 3, then you are hydrated. If it matches 4, 5 or 6, you are mildly to moderately dehydrated. If the urine color is having number 7 or darker, you are dehydrated. So this can be used by the athletes. Based on this, the athletes can consume water throughout the day and they need not wait until they are very thirsty. To avoid dehydration, consume water or sports drinks before, during and after workouts or exercise, and they should be very cautious when they are using energy drinks. In general, 20 ounces of fluid should be replaced for every pound lost during that exercise session. Certain foods, medicines and vitamins may cause the color of urine to change. If these have been consumed in large amounts, this chart may be unreliable. Report all the medicines, vitamins and supplements to the sports medicine staff before assessing the hydration status. Also, report any symptoms of heat illness or general medical illness to the sports medicine staff as early as possible. Students, to conclude this session, let us now just assess or think about some simple tests that can be used to determine if you are dehydrated or not. There are 3 simple questions you should ask yourself every day. Am I thirsty? Is my morning urine dark yellow? And is my body weight this morning noticeably lower when compared to yesterday morning? If your answer to any one of these questions is yes, then you may be dehydrated. If the answer to any two of these questions is yes, it is likely that you are dehydrated. If the answer to all three of these questions is yes, it is very likely that you are dehydrated. So, drinking too little or too much during exercise can be dangerous to your health and can worsen your performance. Therefore, here are some tips given to help you stay in a fluid balance. First one is, determine how much fluid you lose or gain during training or competition and use a chart to record your nude body weight to the nearest pound before and after your workouts. If you lose more than 1% of your body weight, you drank too little during exercise. If you have gained weight, then you have drank too much of water. If you regularly lose more than 1% of your body weight, then try to drink more during and after exercise to keep your body weight stable. Students, remember, it can be dangerous to gain weight during exercise by drinking too much. Thank you.